Looking at the blood vessel model, we're going to start with the major arteries. So we have the heart. So we have the left side and the right side of the heart. So make sure you have yourself orientated. So this structure coming up here, this arched one that's in red, is the aorta. But for this block, we're going to learn the portions of the aorta. So the first segment is called the ascending aorta. Blood is going up through that portion. This part where it's arching is called the aortic arch, where you have those three arteries starting to branch off at. Where it starts to move down is called the descending aorta. It's going to continue behind the heart. Another name for the descending aorta could be the thoracic aorta, because it's within the thoracic region. Once it comes out below the diaphragm muscle, in this area, it's referred to as the abdominal aorta. So that's the first artery. Another artery in this area we've learned before, coming off the pulmonary trunk, are the pulmonary arteries. Remember, these are the ones that are color-coded a little differently because they're color based on their oxygen poor blood. So we have the pulmonary arteries. Next to that are the pulmonary veins, here in red, because they contain oxygen-rich blood. And then the last set of major veins in this area are the superior and inferior vena cava. So up here is the superior vena cava. The inferior vena cava starts to come through here. On the models, you just saw it as the structure cut off there. But then as it goes below the diaphragm, all down here is the inferior vena cava. So it's following along with abdominal aorta. So looking back to the aorta now. So we said in the aortic arch, there are these three branches that come off. The first branch to come off is the brachiocephalic artery. A lot of it is hidden underneath this vein here, but it's a pretty short artery. It's going to start here, go to this next branching, because arteries are going to have their name change typically when something branches off of it. So the first one is brachiocephalic artery. It's called that because it's going to have a branch that goes to the arm, the brachio, and a branch that comes up here to the head, referring to cephalic. So the official names for the arteries that branch off of brachiocephalic, coming over here is the right subclavian artery. You can imagine the clavicle is in this area. So you have right subclavian. And then the one going up in the neck is the right common carotid artery. And it's called common because there's going to be another split later on. So if you feel a pulse in your neck, you're feeling the common carotid artery through there. So you have the two right arteries there. The second branch to come directly off the aortic arch is the left common carotid artery. So that doesn't branch off of brachiocephalic or anything. It's coming directly off the aortic arch. So it's following along, it's parallel with the right common carotid artery. And then the last branch to come off the aortic arch is the right subclavian artery. Left subclavian artery. We had right subclavian over here. Left subclavian is on this side. One of the ways I used to remember, the lefts are going to be left out of the brachiocephalic artery. Or you can think that these come off in alphabetical order. You have B, brachiocephalic, LC, left common carotid, LS, left subclavian. Okay, this model doesn't show everything on the common carotid. It doesn't show the split between internal and external, but it does show the last branch of external carotid, which is that superficial temporal artery. I'm gonna move this back. So that's here. So it doesn't really show the split very well. So you just have to identify these as the common carotid arteries, left and right. But up here, the last branch of external carotid is called the superficial temporal artery. So it's that artery on the temporal bone through there. And again, common is because it's going to split. There's going to be an internal that goes directly into the skull through that carotid canal, supplying the brain with blood. And then the external is supplying kind of the face and the back of the skull with blood. But you just have to know that superficial temporal branch on there. Okay, I'm also going to go over the upper limb in this video. So we had talked about, we have the right and left subclavian. So this artery, it's going to continue all the way through here, but it's going to be given a different name depending on the region that it's found within. So here is the subclavian artery. Once it comes through here, now it's in the axillary region. So that's going to be the axillary artery. And then as it continues down, it's referred to as the brachial artery in the brachial region. Okay, and I'm never gonna put the tag or the arrow like right here. Okay, I'll always put it kind of in the middle of each particular region. And then brachial artery is gonna continue. It's gonna have a split. One split is going to the thumb side. That's gonna be the radial artery. Another split is coming here on the pinky side called the ulnar artery. And then in the palm, you have this artery that's forming an arch here, and that's called the palmar arch. Technically, you have a superficial and a deep palmar arch, but you just have to know it as palmar arch. Okay, let's go back to the veins. So we had talked about, we had superior vena cava, inferior vena cava. Coming into superior vena cava, from here to here, is referred to as the brachiocephalic vein. But this is going to be on the right side, and we have a left brachiocephalic vein as well. So both of those are going to empty into superior vena cava. The one coming from the neck, the cephalic area, this is your internal jugular vein on either side. That's running along with that common carotid artery. And then from here, this is called the right subclavian vein. Okay, but you don't have to identify the veins if we're learning the artery that has the same name, but just keep in mind that that does exist. You do have an axillary vein, you do have a brachial vein, but we're going to learn the veins that are going to be labeled differently, that don't have a corresponding artery. So there's 3 to know in the upper limb. You have this one coming on the outside. This is referred to as the cephalic vein. So it arches up here going on the lateral side. There's one coming in here on the medial side. That's referred to as the basilic vein. So working from medial to lateral, you have BC, basilic and cephalic. And then finally, you have this one that's connecting in here between, this is in the elbow region, the cubital region. So this is the median cubital vein. This is a really common place for a blood draw to be taken from. So sometimes it's called an MC draw or AC draw on the anterior cubital surface through there. Okay, so those are the main structures to know in the kind of thoracic area and the upper limb.